In this 2-minute diabetes drill, I'll discuss tips on proper insulin injection technique. Normally, insulin is released from the inside out, but diabetics take it from the outside in. As a result, injected insulin has to overcome major barriers to reach our cells and exert its effect. About 90% of the insulin we inject is actually destroyed or eliminated before ever reaching its target. Select a different injection site each time. If you inject into the same area, there's a tendency to keep injecting there. Why? Well, for one thing, you might have found an area of skin with fewer nerve endings, so you may be less likely to feel the needle going through. Also, if you've injected in the same place over and over for a long time, the area might have become numb. If insulin is injected repeatedly into the same place, skin thickness tends to change. This is mainly fat and is a side effect of high insulin levels in one place for too long. Fatty bumps are called lipohypertrophy. That's bad, since these bumps absorb insulin more slowly than does normal skin. When you prepare a site to inject, you may use an alcohol wipe to clean off the skin. Make sure to let any residual alcohol dry. Injecting through wet alcohol can sting and burn, plus increases the risk for skin irritation. How fast you insert the needle through the skin makes a big difference on how likely you are to feel it. In other words, the faster the better. If you slowly press the needle tip through the skin, you're likely to trigger more nerve endings and feel it. I call this the Band-Aid principle. When did anyone ever tell you to pull a Band-Aid off slowly? Most insulin needles are very thin and some are shorter than others. You can inject straight in or even at a 45-degree angle based on your size and the length of the needle. It's not necessary to aspirate or withdraw the plunger after inserting the needle through the skin. A nice steady motion to depress the plunger is proper. In this case, slow and steady is fine. Make a habit of rotating injection sites or by keeping a chart to remind you where the last shot was given. Anywhere you have loose skin is an acceptable location to inject insulin. It's only going under the skin, not into the muscle.